Right now we don't have a free market in healthcare, and adding more government involvement from the federal level is not going to help things. It's going to make things worse. And so what I hope that happens as we move forward is at the federal level is that we change tax policy to allow for individuals to purchase insurance and receive the same tax treatment that an employer would when they buy it for their employees. I think once you do that, you open up an entire new market of competition that is going to get at the fundamental problem that I see as a nurse in healthcare is it's the cost. And nobody's really talking about the cost. And that is the issue that we have to break through greater competition and creating a market.
I hear that argument that giving individuals the same tax treatment that employers have, functionally, that's a very difficult thing. It would be much simpler, but probably not very popular, to just eliminate the tax preference that employers get when they provide insurance.
Well, that's a possibility as well. I guess what I'm talking about is I just want to be able to open up the market. And right now people are tied to their employers, and that's the fundamental problem. It was a problem that was started by the government after World War II when we put in, wage controls were put in. And it's because of government that we have the situation. So in general, I think, states are going to continue to do what they can do best. And every state is different. Wisconsin has a very unique situation in that we have one of the lowest uninsured rates in the country. So why should we have to follow through on a plan put in place by the feds, even if we try to create our own exchange, which thankfully we have not done to this point? We would still be deferring to the federal government. And we in Wisconsin know best what we need for our citizens, and we also are more accountable to the electorate here at a local level. And I also would add that as state officials, we need to defer also to our county and local officials so that we can really find out what's happening at the local level and tailor any healthcare plan and healthcare reform to those very specific needs.
A lot of states have refused to create exchanges owing to, I think, some bugs in the law that might be actually features in the law for states that want to maintain some independence and challenge whatever might remain of the Affordable Care Act in court. Why shouldn't states create exchanges?
Well, it's simple to me, and especially coming from a state that has entered into the lawsuit, it doesn't make any sense to, on the one hand, be suing, and on the other hand, creating an exchange. But more important than that, we believe that we have the right answers in Wisconsin, and I don't want to put anything in place that is going to make it harder to reverse later on. And you know that as well as I do. Once you create a law, it's a lot harder to take it off the books. So we want to make sure that we know exactly what is expected. So in Wisconsin, what we have done is the previous governor, Governor Doyle, did accept early innovator grant money, and thankfully Governor Walker turned that money back, and we did not create an exchange. And we're waiting to see what happens in November, because that will determine whether or not we will be able to repeal Obamacare altogether.